We're not going to elevate our care if we don't spend the time combing through everything and really thinking through things.
Yeah.
Melvin Moss used to say, bones don't grow, bones are grown. Invariably, these patients with recession would have a malocclusion. So I would say, well, you have this recession-based problem, but you also have a malocclusion. It would really be beneficial if we treated your bite with orthodontics, and then airway starts to come into play, and then we got cone beams into the office, and now everything starts to expand. We can at least put some guidelines in place for the clinician,
Yes,
where there isn't enough literature, but we can help guide them to make the right decisions based on the available data that is out there.
Yes.
So you've got the periodontal phenotype, and then the other part of it is the bone morphotype. Augmenting the dental alveolar bone phenotype could be something very valuable, not just to move the teeth fast, but to change the regional anatomy. Ortho in particular, they are the earliest caretakers of the periodontium, right? They have the ability to change the trajectory of a patient's life. What level do you want to take care of patients at? The imaging is so important, and it's so important for us not just to look at a small field of view, but a larger field of view. Moms would come in with their kids, and moms would say, well, I had premolars taken out and I don't like how I look. I feel like I'm too narrow and I don't have enough room in my mouth for my tongue, and I don't want that for my daughter. So if we can have something different where we can expand and not take teeth out, I would like to try that. What I've really been most excited about is the early intervention. Some of the orthos that I've been able to work with now who are looking at patients very much earlier, looking at nasal breathing, looking at the nasal maxillary complex. You have the chance at an early age to intercept these patients, shrink their tonsils, improve their arch forms. The younger kids, they're just much more adaptable, right? And when you do that, you're going to have a very robust periodontium. That's the power of what you can do with early intervention. Hopefully, my daughter will be going to the orthodontist asking the question, how are you going to improve my child's airway? It's an exciting time to be in practice, and I think what we can do for patients is beyond what we ever thought we could do. To be able to be a part of an interdisciplinary plan that has an impact on a patient's well-being, you can't put a price on it. I'm really excited about just the whole future of our profession, because I think it's really one of the best professions anybody could have.